All right, this morning, healthcare is officially expanding in East Texas. Hospitals and smaller clinics are working hard to bring specialists to our area so people don't have to travel far for the care they need. Our Marangeli Lopez takes a look at what's currently available and what's in store for the future of healthcare right here in East Texas.
From hospitals to small clinics, the healthcare industry in East Texas is growing.
We just are not a healthy part of the state or the nation.
And the growth meets a high need. East Texans have higher death rates compared to the rest of the state and the country. That's according to a recent study by the UT Health Science Center at UT Tyler.
And then gets worse. If you took those 35 counties and made them the 51st state of the nation, we'd be at the bottom in almost all the indicators.
Tom Mullins explains how East Texans are leading the state with higher rates of stroke, cancers, diabetes, and obesity. That's one of the reasons he's worked with the UT system to bring a medical school to East Texas.
This school will train people from technicians to nurses to full-fledged medical doctors to provide services to that needy population, and then hopefully bring up those negative numbers, get us off the bottom, and make us more healthy.
It's one of the long-term solutions UT Health East Texas has in store for its facility. This new medical school aims to train the future doctors and nurses that will provide care for our community. In the meantime, Thomas Cummins, UT Health East Texas Chief Medical Officer, says a new internship program will provide hands-on training for nursing students.
In addition, we've just recently started a nursing extern program in partnership with UT Tyler, which brings in nursing students into our system, allows them to get some clinical training and clinical hours, and then in turn we turn around and hire them back as graduate nurses.
And it's not just education. UT Health East Texas recently expanded its cardiac plaza, providing education and care for one of the leading health issues in the community. And earlier this year, a new neonatal intensive unit was unveiled, giving an option for new parents with premature babies. Down the street, Christus Trinity Mother Francis is also expanding.
You know, it's harder to get health care literally when you leave Smith County.
President Jason Proctor says their emphasis is providing care to hard-to-reach areas in East Texas.
And we look at where our patients live, we look at the zip codes and where they come from, and we say, look, that's a place where we need to have better access.
He says another emphasis is finding ways to provide care for patients coming in with heart disease and cancer.
Patients were getting cancer and having to go to Houston or Dallas or some far-off place. And now that we have those services here, they stay here.
The Northeast Texas Cancer and Research Institute is brand new, and it's in collaboration with Texas Oncology to bring specialized cancer care to our region. Another area of growth the hospital system has seen, it's children's services through the Children's Miracle Network.
We have a very busy NICU. We do pediatric surgery. We're the only pediatric surgery program in the whole region. There's a lot of stuff that goes on with kids around here, and CMN really helps that.
Both health systems agree their goal is to provide consistent care to meet the needs of East Texans where they live so they don't have to leave the region.
Great story there. Thank you so much, Mara. Now, while UT Health East Texas and Christus Trinity Mother Francis won't turn away any patient in need of care, there are services in East Texas that provide low-cost health care for the uninsured. The Bethesda Health Clinic, a nonprofit right here in Tyler, actually, is just one of those examples. You can learn more about the services they provide over on our website, cbs19.tv.